While it's clear that social distancing is critical to blunt the impact of the pandemic, we also know that the sooner we can return to safely congregating, the better. The choice between saving lives and saving livelihoods is false. She claims it's possible to develop non-pharmaceutical strategies to suppress the virus, to protect frontline workers, to find smarter ways to allocate and distribute supplies and other critical resources. Talk is a call to innovators to put on as much data and computing power on these challenges as we can now. With that, Julie, the floor is yours.
Excellent. Thank you so much, Randy. Thank you all for joining today. So I'm Julie Shah. You all know me. Many of you know me, faculty in Aeroastro and CSAIL. Usually I come to you talking about my robots and people and robots working together in factories, hospitals, other settings. Today I'm bringing you a different topic, and I'm bringing you this topic with multiple perspectives. So I'll just show my title slide here. I'm going to be talking about the ways that we can all come together to use computing to address the social impacts of COVID-19. I'm giving this talk on behalf also of my co-associate dean, David Kaiser. Together we're the Associate Deans for Social and Ethical Responsibilities of Computing within the College of Computing. So I will say that this talk is going to be a little bit shorter because it's a call to action. It's a call to ask you to come together, to reach out, to join the effort to be able to have an impact. And hopefully it's something that you can bring back to your groups and share with others. So I'll start, just without the slides, just me for a bit. I bring three perspectives to this talk. One is as an AI researcher and a roboticist. I'm also a head of house in one of the graduate dorms in Sydney Pacific, which is our largest graduate living community on campus, where I spend a lot of time and very lately, a lot of time thinking about the operational details of how we live here at MIT. And then as an associate dean in the College of Computing, I've also spent the last few months working together with Dave to build connections and facilitate new relationships across campus, with folks in Shah, Sloan, as well as looking outward to think about how it is we can make the most of the college as a new opportunity to address our current greatest challenges, which are using and developing computing for our collective good, but also with our eyes that are very open to the social and ethical concerns that come hand in hand with these new technologies. So, with those three perspectives, if we roll back to kind of late January, early February, which now seems like a lifetime ago, my husband and I were pretty glued to the news. I was watching kind of intense interest as China was beginning to employ surveillance technologies to restrict the movements of their citizens to stem the spread of the virus. And my husband, who is a public health researcher and a doctor at Harvard, it was quite alarmed to see clear strains of the hospitals and healthcare workers to keep pace. I think maybe in part because I'm married to a healthcare worker, but also in part because of our role in the dorm, this became real to us quite quickly. So at the end of IAP, our 700-person dorm had a few dozen people that returned from China and needed to go into self-isolation. And so we spent our Super Bowl Sunday working through what those self-isolation procedures would be for the safety of those students and for the rest of our community. And in the weeks since, I think we've all gone through the same thing of our world changing so rapidly. In the weeks after, I have to say, as we went through the process of de-densifying the dorms and addressing the questions and hard decisions that many of our residents had to make. Being a head of house is about being in the operational details, but my perspective kind of narrowed from the sort of global view to hyper local. I would, going kind of days without even looking at a national headline, because what's happening on the West Coast may as well be on the moon, right? All of us are just trying to re-engineer, everything about our everyday lives. And, in the midst of that, after the evening Zooms and town halls, you know, my husband and I, we would put our kids to bed and we'd have a few minutes to kind of reflect. And, you know, we couldn't shake this sort of, you know, growing sense of, you know, frankly, kind of dread, not about what tomorrow would bring, but just, you know, the dawning realization of what our weeks and months ahead are going to look like. And you know, it's unquestionably grim. So in the next 6 to 18 months, like 20 to 60% of our population may contract the virus. Hundreds of thousands, maybe 1 million or more around the world may die. And you know, we're taking necessarily severe measures currently, such as social distancing and sheltering in place. But the truth is, these are really a stopgap measure to slow the spread, to literally flatten the curve, just to buy time to get the necessary resources in place. And what we're doing now isn't something that can be sustained over the long term, even for, you know, an economy as robust as the U.S. Never mind many other you know, many other places around the world. And it can't be sustained over a time that would be necessary to eradicate the virus. So we will necessarily have to relax these social distancing measures. And the question is, you know, what can we do, like picking ourselves up out of the operational details, what can we do here to change the trajectory and make a difference in this unfolding crisis? And I'll say that my husband, he's a wonderful person. He brings a lot of expertise in this area, but we're also longtime collaborators, and, you know, spending so much time as longtime collaborators together, you know, we did, you know, put pen to paper and draft an article that was released in Harvard Business Review last week, exactly on the different ways, the different opportunities we have to deploy data and computers against the virus. And, you know, I think it's on us here, especially at MIT, as innovators, to begin, you know, asking the questions. You know, this really ought not to be a zero-sum game between saving lives and saving livelihoods. You know, how is it here that we can mobilize, bring our resources and expertise to change that equation? And so my goal in this talk, along with Dave Kaiser, is to ask you to contribute your expertise, and thereby the expertise of MIT, to act in service and help respond to the crisis. And what I'm going to do is share a few very specific efforts of many that are underway here at MIT, where much of what we can provide in the College of Computing is of great value. And it's to give you a few concrete examples for a sense of how you can potentially dock into this. And so I'm going to talk about 3 opportunities in using computing. And the first is in moving from mitigation of the virus, the social distancing, shelter in place, to begin to think about smart suppression of the virus, smart monitoring, forecasting, and targeting of interventions. The second is around smart utilization of our critical resources. And then third, in risk-informed delivery of our essential services. How is it we re-envision delivery of essential services? So for the first, you know, smart suppression, you know, our current strategies involving, you know, blanket isolations and shutdowns, again, are buying us critical time. But you know, as we relax them, the virus will continue to spread. And these blanket isolation and shutdowns are you know, tremendously difficult for many local small businesses, self-employed, families struggling. And what we need to move towards is instead smart, targeted, sustainable strategies to suppress the virus, to allow return in certain places at certain times to workplaces and schools. And so this involves harnessing, you know, in some cases, repurposing the existing technology we have, developing the new technology as well to be able to smartly forecast the current extent and spread of the virus, not at a population level like many of the typical models do, but at a hyper local level, we need to be able to dynamically assess risk in communities and make local decisions that account for our very substantial inherent uncertainty to decide which communities, businesses, or schools can move to a physical presence for how long, what travel restrictions should be in place, and when. And so the big picture question here is, well, what if instead of shutting down whole economies, we brought to bear the technology to understand how to turn this into a type of like local storm warning that we respond to in a targeted way. So, deciding which workplaces and which schools can or should be open, what forms of social distancing are put in place. So these are questions that concern us very personally here at MIT as we think about reopening for the fall. These are decisions that need to be made at the state level, at the national level, and also globally. What I'll do for each of these categories is highlight one or two ongoing efforts here at MIT, aiming to span those different levels, sort of global, state level, and then very local level for us. So the first one that I want to talk about is a project. This is being led by some really outstanding superstars in the policy world, health policy at Sloan. And this is doing computational modeling and analysis of COVID-19 disease dynamics, prediction, and developing optimized intervention strategies. And this is, our superstars over in Sloan are quite connected with key decision makers in countries around the world. And the needs here are to bring what we have in the College of Computing to better understand what drives differences in outcomes and forecasts among various commonly deployed epi models, to refine techniques for parameter estimation under uncertainty, using all available data, including new data streams, and then to understand the efficacy of the different possible interventions or control strategies, and how those can be made possible through socioeconomic recommendations. And so this is guiding public health decisions on effective sampling, testing, and intervention strategies with what are very sort of heterogeneous populations. And so, I think, a question, you may have here is, well, this is okay, but, I don't have expertise in addressing policy questions. I don't do epidemic modeling. And I guarantee you have the relevant skill sets for this. And we can determine that by asking you a simple question, can you model a dynamical system driven by a set of ordinary differential equations? So if the answer is yes, then we need you. For this first bullet, one of the core concerns in this project over the last 2 weeks was that for some countries, decision making is being done looking at a set of different models, all of which make different assumptions for parameters that implement different intervention strategies, and are not doing explicit sensitivity analysis to those parameters. And so, before I take this to you, obviously I took this to my lab and to ask the questions, well, what can we do to be helpful? What can, Dave Kaiser, ask the same question. And a roboticist, sort of roboticist in my lab, as well as a physicist who studies particle physics and cosmology, was able to make a substantial contribution to helping inform the types of public health decisions that people around the world are having to make in short order now. And so, this is a very near-term thing. Looking a little further out, how are we doing this? We do it in collaboration with the folks at Sloan, as well as a number of renowned modelers, epi modelers that help guide these efforts. But this is sort of a whole world crisis, and there are not enough people to help in doing this type of work right now. Looking a little bit forward, you look at these models a little further, and ultimately many of these models are performing dynamical system analysis. They're employing Bayesian non-parametrics for parameter estimation, these are also our bread and butter, for example, in robotics. And so, yes, we and also you do have things to contribute right now to this effort. Looking forward, there's enormous research opportunities. There's a lot of models out there. There's a lot of data collected already, but some open research questions include how can we actively learn from estimation? How do we do parameter estimation under uncertainty? How might we automate control strategies through socioeconomic recommendations? And discover the most effective interventions in the coming weeks and months. And so this is something that plays to many of our strengths here. And so support in working with the data sources, performing parameter estimations, modeling, as well as collaboration on impact and policy analysis, are all places we are looking for you to dock into. So, one thing you learn from working with these models that I've learned over the last 2 weeks is that, as I mentioned before, there's no lockdown of reasonable length that eradicates the virus. And so, we are looking at a very changed world into the weeks, months, maybe a year or more ahead. And just like theoretically, if there are a few dozen people that still have the virus when you relax these measures, it spreads, and how can you find those people with the tests that you have, with the data sources that you have? Contact tracing is absolutely essential to this. Some of you may have seen the outstanding MIT News article on the pioneering work being done here at CSAIL with Lincoln Labs, partners in the Media Lab, on digital contact tracing. And this is aiming to develop technologies that allow to offload the burden of the sort of call centers for manual contact tracing to using existing mobile technologies that sort of chirp and in sort of privacy preserving ways, so that when someone is found to have the virus, others can be notified that they were in physical proximity to someone that fell ill. And so, these are really outstanding efforts. I want to, I'm not a privacy expert. I'm not an expert in this area, but this, along with watching what else is happening at MIT in terms of community surveillance testing, and then just the questions that come from the dorm. I think it's important for all of us to ask ourselves, what might we be able to bring to accelerate this progress and make this something that's real, something that can help us in our community here and the rest of the world. And in my role as head of house, and learning a little bit about these efforts, it dawned on me. My lab has substantial experience conducting human participant experiments. We have an amazing set of graduate students in the dorms that are looking for ways to better our living environment and our situation. And we have these technologies that are ready to be matured. And so, in a really inspiring way, in the last few days or week or so, a team has come together to develop a system that we can deploy and test in our residential communities to understand risk associated with spread of the virus here, to understand the relative benefits that digital contact tracing brings to augment manual contact tracing. And so partnership with sort of professional support through Lincoln Labs, through the Quest, through a whole set of graduate student volunteers, both planning to help with implementation and tests. And hopefully we can contribute to our community, but also to hardening the technology for others to use as well. And for this effort, we will need many, many of you, especially those living in the residential dorms, to help us through the test and development process. And looking forward, other things to just be inspired by. What testing strategies do we have to understand the risk associated with certain areas across the country, certain hotspots? well, what are the new sources of data we can bring to bear on the problem? And I'm showing you an article here published in Stat about a week ago. This is an MIT startup that analyzes wastewater for bioindicators of human health. I happen to know the CEO of this company because she was previously on the executive council, the student government of Sydney Pacific, an outstanding leader and now doing really great work. And in running their techniques, they asked the question, might it be possible to detect the virus in wastewater? And in this article published, they found that there were at least maybe 2,000 or more people in the Boston area that had the virus, and at that point only about 400 plus or so had tested positive for the virus. There's very limited testing, and so that's directionally correct. And so you take contact tracing together with these new sources of data, and we have the building blocks to come together and make something that can make our world sort of a much better place to live in for the weeks and months ahead. The next area I want to talk about in terms of opportunity is smart utilization of critical resources. And so, we're buying time right now to ramp up supply and get more material where it needs to be. But in addition to conserving and making more, there's enormous opportunity to think about smart utilization and procurement of these critical resources. Basic resources, key medications, sanitizers, masks, even tests. There's dire need for these at the big hospitals, but also in nursing homes, assisted living facilities, grocery stores, grocery store employees, other essential workers. And so, a key question here would be, can we assemble response teams to harness computing that's able to help forecast or predict the needs of these community organizations, frankly, as well as we can predict people's shopping preferences currently. What are the ways that we can be able to collect the data, make this easy? It's a burden right now, an already very strained system to get high quality data. How can this information be aggregated, develop forecasting prediction models? And then how can we help support the development of coordinated networks to help ensure these resources can be rapidly deployed to the right places? And I'm going to give you one example of a project underway led by faculty in Sloan and the ORC. And this is in supporting nursing homes and assisted living facilities in Massachusetts. So there's about 400 of these facilities, and they are relatively organized through Massachusetts Senior Care Alliance. And they have, a number of challenges in terms of, disparity between existing resources and capabilities among the different facilities. Rural facilities have less access, immediate access to resources. Getting data from these facilities is quite a problem, but it's imperative that they understand their needs and potentially coordinate to ensure that everyone in these facilities is taken care of safely. And so the computational opportunities here are in estimating and forecasting these resource needs. Again, conducting sensitivity analysis to the key parameters, personal protective equipment required per nurse per shift, how that depends on the number of patients. Understanding and better predicting spread to these facilities and the design and mitigation strategies, and how to better, more efficiently allocate PPE to facilities in the network, and to be able to redistribute between facilities. And again, many opportunities to help really an already very inspiring team working these challenges. This is sort of one example of many opportunities. And so the last category I want to talk about is being able to rethink how we deliver essential services and being able to do this in a way that's more informed by the risk. And so here we have a set of challenges around the fact that many essential services are delivered under risk that was not there before. We are moving to remote work, but obviously not everything can be done remotely. It is possible that as we make this shift, remote work simply becomes a part of how we think about work. And here too, we have an opportunity for computing to help us weigh and understand the risks and benefits of when people need to be working alongside one another, and when they don't. What are the ways that we can more effectively team up remote expertise with co-located sort of physical presence? And really, it's a new type of teaming. If you think of how sports teams sort of compose their rosters, developing metrics for understanding how to deliver, what are the new collaboration technologies that can facilitate this? Like, how do we reinvent how these essential services are delivered? And a very concrete example of this right now, again, is in nursing homes and assisted living facilities. There's a shortage of nurses and nursing assistants. And so this is led by Sloan, a number of members of the Work of the Future Task Force, working through accelerated training programs for these nurses and assistants for the, for sort of the a CPA type role, going from 6 or 8 weeks to something much shorter, to be able to get people in to help right now when and where they're needed. There's computational opportunities in being able to support the matching of capabilities with considering locations, proximity, hours that people can contribute to working in the facility, the existing coverage in the facilities, and balancing the sort of real opportunity for central coordination, but the very real needs for local management and execution. And so, taking a step back, as a roboticist, as many people see in our current context, there is a role for robotics in managing the sort of acute side of the public health crisis. Many robots that are being used to help support sort of disinfecting hospitals and other areas. But there's also enormous opportunity to think more broadly about how the technologies we've been honing and developing for many years in factories and warehouses and other facilities can now be redeployed and redesigned to more effectively deliver services with fewer people on the front line. And so new forms of human-robot collaboration for facilitating remote work, for making the work that has to be done by people more efficient, can also be game changers in this context. So, so I'm getting towards the end here, and there's a few notes I want to sort of give at the end about how you can reach out to get involved, and sort of things to think about as you're thinking about reaching out. So, do you have relevant expertise? The answer is yes. Machine learning, estimation, feedback control, optimization, frankly, even just reasonable software development expertise is enormously valuable. The ability to, or the willingness to iterate and test and help harden technology on campus is enormously valuable. And these are things that might not make you, that are kind of like our bread and butter here. But in a worldwide crisis, these are very unique and special skills we have to contribute, sort of our MIT basic skill sets. So, the next question would be, so I have that expertise, but I really don't know what the needs of the decision makers are. This isn't my world. What are the real problems where I can be helpful in the short term? And that's where Dave Kaiser and I are here to be as helpful as we can, being able to connect the right folks with the right expertise and interest to the policymakers and the decision makers, and the ones that can help interpret needs. And I'd say, I think one thing to keep in mind is that this is not necessarily to start a moment that requires your fanciest methods and modeling tools, but it's about trying to jump in and be of service and understand the needs, to be able to communicate effectively, to be able to work across disciplines. Timing is of utmost importance here. These are decisions that have to be made with the information and the data available. And so what can we do to support better decisions and to build opportunities to deploy technology that can really be game changing for us a few months from now. There is this very clear tension. As an academic researcher, a large part of our value is focusing on the long term. There's many people who really do need to be focusing on the day-to-day sort of really operational level. And then the question here is where can we come together kind of in the middle for those of you that are willing and able to. And this is something, to weigh individually and personally. My experience working in this realm is relatively new, but I map it pretty closely as a roboticist to the fact that, to have impact and deploy, a real system, to be able to show the effectiveness of our new fancy model or algorithm, we have to do a lot of engineering, and we have to understand the real needs, for example, on the shop floor, to be able to inform our research and to have the ultimate impact that we want to have. And this is the opportunity here, is to not necessarily undertake long-term research efforts, but to ask how can we mobilize task force response teams to help build the solutions for 6 months from now. And we can do this at all levels. This is about thinking about how to reopen our campus, how to support decision-making at local, state, national, as well as global levels. So there's there can't be enough of us working on it right now. And so, and the last thing I'll say is, by jumping in and building these relationships, it's already clear to me that this will change the type of research my lab does, in the long term. There's a lot we can all learn from this to drive, our research interests far beyond 6 months or a year. And so, so please do, I've had the email address up through the entire talk. Please do reach out to circcomputingcovid@mit.edu. And, please share with us a little bit about your role at MIT, your skill set, your expertise, for example, modeling, simulation, languages, app development, HCI, experiment design, ethnographic observation, qualitative research design are very important. In what ways might you be willing to pitch in and offer, some of your expertise and skill set? What might you be able to contribute over the next few weeks? And thinking longer term, in the weeks and months ahead, what would your interest be in contributing as well? And what would you need to do that? For example, RA support. If you're not a PI, please, confirm this proposal with your PI. And then lastly, thinking towards the future, what are your longer-term research interests, and what types of collaborators would you most benefit from working with to pursue these interests? And so please share this with your colleagues and reach out. This is not a research proposal where we'll be judging you and bringing you onto a team. This is about making an initial connection to be in conversation and figure out how we can all work most effectively together. And so with that, I can wrap up and take any questions. Thank you so much.
In the meantime, I had a question as we wait for others from the group. You've talked in a very inspirational way about the large-scale challenges we're facing here and the enormous value in lining up people with skills with those who need the skills. Are there, going at the other end of the scale, are there specific projects that you know of right now that strike you as really interesting? Sometimes a concrete, smaller scale project is something you can wrap your head around, and then you can say, oh yeah, I could see how I might contribute to that. So what are 1 or 2 or 3 of those that you know of that you think are interesting?
Yeah, so the examples I gave here all have, I think, both very immediate opportunities to contribute, as well as, I think we need to do some capacity building in this sort of intermediate range looking forward to. So, just to give you kind of one example, with nursing homes and assisted living facilities, an amazing team of LGO students students from the ORC that have been helping to try to understand what order should they put in for forecasting their needs for PPE, and that order is like something that's going in tomorrow, right? It's very short order to be able to help, with the data that is available to help support, key decisions with hard deadlines. But with additional capacity, what can we do, not just meeting those short deadlines, but to be able to gather the data to develop really fine models for forecasting those needs over time in the weeks and months, to get better, to more efficiently utilize resources, ensure that the remaining are getting elsewhere to where they need to be. And so, that's just one concrete example. The other one is in the dorm, trying to understand the effectiveness of digital contact tracing. Some with existing infrastructure solutions, some with very new technology, so Bluetooth to Bluetooth technology. There are a lot of research challenges and engineering challenges on hardening that technology. That residents in our current living communities could really help with the development phase by helping with calibration, and then ultimately in the experiment phase, downloading the app and helping to understand how a privacy-preserving architecture can add value on top of to augment the current manual contact tracing process. So, app development clearly, but even just being a savvy user and being able to provide feedback and input to the development team in the coming weeks to improve that technology is enormously valuable. There's a role for extracurricular sort of part-time support for many of these, and also very much a role for those that are willing to dive in and do as much as they can in a short time.
Okay, great. We've now got a couple of questions. One is there any work on modeling and addressing some of the longer term problems? The one I have in mind is the potentially massive problem of food distribution. We're hearing increasing stories of food being thrown away due to lack of distribution capacity. This is probably just one example of a long-term and sustained problem. Do you know anything to offer on that one?
So I also noted those news headlines and had a similar had a similar thought. We do have supply chain experts, a few of which did a really nice news article, either from IT News or Sloan, kind of a 3-question style thing. And with someone with an interest in that, please do reach out via this email address, and we'll work to connect you with the right folks who can help understand the ways we might be able to help address these issues.
Okay, good. Another question. Imagine that the problems in this domain have lots of analogies with the current push for distributing food and gloves. That is the problem with food. Sorry, said that way. The problem with food is probably analogous to the push for distributing masks and gloves, etc. But I agree that putting more resources toward distributing other critical goods and services is important. So basically, they're just agreeing with you, I think, in saying this is an important problem to get out there, and thank you for sensitizing people to it. Let's see, another comment. Thanks for the inspiring talk, Julie. For the flip side of contributing skills, is there a way for teams working on COVID projects that are looking for more help to also get in touch about the skills and resources they need?
Excellent. Thank you for that amazing question. And I'm sorry I did not say that up front on this slide. I had made a mental note to. Equally important is those that are working on projects, yes, that would like to be connected with the people that reach out offering their skill set and expertise. Please do reach out with a description of your project and your needs. And that's the other side of the equation for the matching. So we have some set and some scan of some of the projects, but please do help us flesh out that list so that we can be most helpful to you.
And Julie, do you have, as you get these things in, do you have any idea of the time scale of response? If I send in a description of me today, am I likely to hear something back this afternoon, later in the week, next month? I know it's probably hard to predict, but you have a gut level feeling for it.
So we'll aim to connect back to you, within days to open up a line of dialogue on your interests and what this might mean going forward, and then work to have the conversations with the folks with the projects, and do that matchmaking and capacity building. We have a few projects where we have a clear path towards doing that, and others it's actually, don't think of this as just our list and we're trying to do matchmaking. A large part of this is sort of leveraging your creativity, your innovation to understand what are the gaps, what are the projects that we could or should be undertaking, and then Dave and I can work to help make the connections to catalyze efforts in those areas. We'll aim to get back to you on the order of days to begin a discussion.
I will take that as you've piqued their interest and they're going to go off and think about that. And with that, I think we should thank Julie for, as someone here said, thank you so much for everything you do. And I suggest let's see, where is it? The reactions. Okay. How about a thumbs up or a hand wave for Julie and this wonderful talk?
Thank you all so much. I hand wave back to you. Thank you for coming out, and it's really nice to see you all virtually. I look forward to seeing you in person again soon and then connecting in the meanwhile. Thank you all so much.